Okay, well, hold on here. Consent to being recorded is checked. So, yeah, as Mary Grace said, I'm Dr. Angela Hanson. I'm a geriatrician, and I study, when I'm not working in clinic or in the hospital, I'm studying brain health. And my ultimate goal in my research is to try to figure out what should we be eating to keep our brain healthy, both when we're younger and when we start developing memory loss. Are there different foods or diets that we should eat or avoid? So that's my overall theme of my research. So I try to stay up to date on a lot of this, but maybe I'm missing something. So we'll make sure we leave a lot of time for questions and comments. Okay, so a little bit of overview. I'm going to sneak some non-diet recommendations in while I have a captive audience, just because I think these are really good recommendations. We'll mostly talk about diet, and then a little bit about, it kind of depends on the stage. If you're talking about preventing dementia, I think that's a very different topic than if someone has pretty late stage dementia, what should they be eating and what should we be worried about? And then again, time for questions. Okay, so these are the recommendations I warned you I was going to sneak into the talk. So there's a group called the Institute of Medicine, and they are an organization that it's a group of policy experts on a wide variety of topics, and they sometimes Congress or the NIH will ask the Institute of Medicine to convene a panel. And they did this in 2015. They said, hey, get all your experts together in one room, when we could meet in a room, and tell us what we know about healthy brain aging. And so they released a very, very long report, which you can read if you want, but I'll tell you some of the spoiler alerts, the hints that were kind of the top 3 actions that this group found to protect your cognitive health as you age. I'm just realizing some of you may have windows that block the slides. You should be able to move them around so you can see the slides. So I'm going to go over these just very briefly, and then we'll get into the diet data. Okay, so the top 3 actions. The first one is they say reduce cardiovascular risk factors, which is kind of a mouthful. What do they mean by that? These are the things doctors have always tried to do. It does get a little repetitive, I suppose, but really recent studies have shown that anything that cardiologists or doctors have told you about your heart health, it turns out they're also important for the brain and also preventing Alzheimer's. So it's still important to treat blood pressure, high cholesterol, screen and treat for diabetes, and avoid smoking. All of these are risk factors for Alzheimer's, in addition to heart disease. So there's a lot of shared risk factors, and these are just really important, and continue to work on those. The next point was to be physically active. Now, what does that mean? That means a lot of different things to a lot of different people. So before I get into that, I'm going to talk about the hippocampus. Some of you may have heard about this, the hippocampus. It's actually a part of your brain. It's deep inside your temporal lobe of your brain, so kind of near your ears. It's actually pretty small, and I'll show you on the next slide where it is in the brain. It looked like a seahorse to pathologists long ago, so they called it the word for seahorse in Latin. It's a part of the brain that's really important for turning short-term memories into long-term memories. You can imagine your brain doesn't want to turn every short-term memory into a long-term memory. Many of them you can just forget. But some things you want to store for a little while, and some things you want to store forever. And your hippocampus is important in kind of sorting and directing those memories. atrophy or shrinkage of that part of the brain is an early and sensitive sign of cognitive aging or Alzheimer's. It's not specific for Alzheimer's, but it's pretty reliably smaller in people that are developing Alzheimer's. It's an area that we look at. So hippocampus and the health of that might be kind of the canary in the coal mine for brain health and what we look at first or early. So what we're looking at here is it's a fancy kind of MRI that we can get in our clinic, and it's looking at you as it's called a coronal section. So as if we're looking at you and you're looking back, so sliced this way. And I think you can see my mouse. Over on the left is a healthy brain, and the hippocampus is automatically coded in yellow here. It's nice and plump. You can kind of see what they're talking about with the hippocampus being, it's kind of shaped like a seahorse, a curved structure. In a patient with Alzheimer's disease, that hippocampus is smaller and there's bigger spaces around it. And then you can see just the brain itself is just more atrophy or shrinkage. All right, so I talked about exercise, and we'll talk about what we mean by exercise on the next slide. These are some studies, one of which I was involved with, the bottom study, showing that if you take people in a research study in the lab and you make half, well, not make, they volunteer, but you say half of them get an exercise program and half of them get kind of stretching exercises, so kind of the control group. In 120 older adults, the people who exercised, actually, not only did they not have hippocampal atrophy, but their hippocampus actually looked bigger. And we think that may be because of the health of it and better brain flow, not that it actually grew, but it didn't atrophy over a year, whereas in the people that didn't exercise, they showed kind of aging and atrophy of it. And other studies have shown that exercise improves thinking abilities, it improved blood flow to that area, and it also just reduced Alzheimer's markers in the spinal fluid, which is the fluid that coats the brain. And this was in people who had early stage Alzheimer's. So it's not too late to start exercising, even if you've been diagnosed. And what do we mean? Well, here's where it gets complicated. I think when we're doing really solid, careful clinical studies, we have a very set definition of exercise, and it's usually this one. It's the American Heart Association, or the AHA. So those, like, you get labels with the little hearts on them from them sometimes. They recommend that you get 5 days a week of at least 30 minutes of moderate exercise. And that can be a wide variety of things. And usually what they mean by moderate exercise is defined as getting that heart rate up a little bit. So you're a little short of breath, but you can still talk a little bit. If you do vigorous exercise, you might get away with doing less. So if you run, you might not need to run 5 days a week. But if you walk 5 days a week is considered the recommended dose. And then more and more people are recognizing that resistance training or weights is also important for exercise health. So that's what we mean by exercise. I will say though, even if you don't get 5 days a week, 4 days a week is still better than none. 3 days a week is still better than none. And you know, if you're starting from not getting much exercise at all, you know, you want to start low and go up, and certainly talk with your doctor if you're having any chest pain or a lot of shortness of breath of exercise to make sure you're not missing a lung or heart problem. But most people can go ahead and start exercising without getting a whole big rigmarole from their doctor. Okay, the third recommendation of the Institute of Medicine is to manage your medications. And what they mean by that is, first, know what drugs you're on. You don't have to pronounce them right. I don't pronounce them right. Print a list out and have it in your wallet or your purse and know what they're for. And also, if you take anything over the counter. So some medications can actually cause cognitive impairment or make it worse. So it's just important you know what meds you're on, what they're for, and setting aside a visit with your doctor to say, hey, are these medicines appropriate for me now that I'm 70 years old or whatever? And pharmacists can help with that too. Okay. So the topic we promised you, what should we be eating for a healthy brain? So I just thought I would start by saying, like, there's probably not going to be one right answer to this. And in fact, what I study in my lab is that it may be different for gender. It may be different for people who have certain risk factors like genes for Alzheimer's. I think that it's true, and it makes just sense to me that what you need to be eating if you're living in Alaska, fishing village, is probably very different than what you need to be eating if you're living on the equator in a hot climate. And so there's a lot of factors that go into what should we be eating just in general, like how old are we trying to run a marathon, are we trying to keep healthy from diabetes? There's just a lot of factors that go into it, and because of that, it's kind of complicated. And anytime there's something complicated, people with very simple solutions can kind of sound the loudest sometimes, like you should only eat this food or eat this diet, it's the only one diet. I would say, thankfully, I mean, if this makes sense, if you travel around the world, there are several different types of diets that are healthy, and you don't have to give up food that you like. You have to pick a diet you can live with and that is in line with your cultural values and what you enjoy eating. And I think there's ways to do that no matter what kind of base diet you're starting from. So the best studied diet is the Mediterranean diet. And I guess I should have put this on the slide, but I just want to put a little caveat is, notice I said the best studied diet. Well, who's doing research studies in Alzheimer's? It's people in Europe and America. And so they're not necessarily studying diets that they're not eating. So this is a little bit Western centric. However, I think a lot of the things that they're finding could be applied to other diets. And I'll bring up other types of diets too as we go. But the Mediterranean diet, which we'll talk about what that is, there's a couple studies now. So the main studies that have been done is what it's called epidemiology. There's no there's no randomized trial or anything. It's just following people over time, and people that tend to follow a Mediterranean diet tend to have a healthier brain. That's the pattern that keeps coming up over and over with these studies. So one study from France showed that people who tended to eat a Mediterranean diet had healthier white matter, and I'll show you what that is. A study from Australia, people who followed this MeDi diet tended to do better on memory tests, had larger hippocampuses, you know what that is now, decreased amyloid on a brain scan, so amyloid builds up in Alzheimer's. So this is white matter. So I just took this from Google Images. It's two different pictures of a brain. On the left, you have kind of low white matter, these white spots in the white matter. So the white matter is the connections between brains, or between the parts of the brain. We don't have connection between brains yet. So this is the white, there's just a little bit, we all get some white matter wear and tear as we get older and have high blood pressure and stuff. So a little bit is okay. What we don't want to see are large spots like this. And so white matter, in addition to the size of the hippocampus, which is gray matter, white matter disease is another marker we think of cognitive aging, and we want to see less of it with healthy eating and stuff. Okay, so I'm going to talk about the MIND diet. So let me go back. So these studies started coming out, and there's this Mediterranean diet, and then there's Mediterranean diet kind of means different things to different people. And what are there specific types of food in the Mediterranean diet that could generalize to all diets? There's a group at Rush University that studies this. The late Martha Claire Morris wrote a book about it, which I'll have a snapshot of in a minute. But Rush University in Chicago is a really big lab that studies this. They get into the real details of what is it about certain foods and diet, what is it about certain foods in the Mediterranean diet, and can we make the Mediterranean diet even healthier by adding other recommendations? So what they did was they came up with what they call the MIND diet, and it's just for them. It might be an acronym, but I just think of it as the diet for the mind. So they take the principles that we know from the Mediterranean diet, and then they add some other things that we know, like low salt for blood pressure and some of that kind of stuff. And the diet emphasizes 10 healthy food groups. And I think I have this on the next slide, so I'll go over it then. And then they also have some list of kind of don't eats. So don't, or at least avoid cheese, butter, margarine, pastries and sugary foods, red meat and fried food. So eat more of these and less of these. Evidence for the MIND diet. So again, Dr. Martha Claire Morris and her daughter wrote this book. The first few chapters are go over this science in detail, and then the last part of the book is actually recipes. But they looked at 923 people who tend to follow their MIND diet, and people that tended to follow the MIND diet had a less risk of developing Alzheimer's. So these are those 10 foods for brain health. So chicken, fish, green leafy vegetables, other vegetables. Fruits fruits isn't specifically on here, but berries are on here. Nuts, olive oil, wine, and we'll talk about wine on alcohol, beans, and whole grains. So these are like the 10 kind of basic foods to build your meal around. And then just a little bit of data on some of the specifics. So this is a very small study, but there's a study of 9 older adults that drank blueberry juice, did show improvements in memory. There's a lot of data about fish. I could talk this whole 20 minutes about the data for fish, and it's pretty complicated, but what I would say is the best data is for fish and seafood, rather than trying to get just the oil DHA, because you can think about it, fish just has a lot more to it than just one type of fatty acid. So this is a Rush University again, Dr. Morris in Chicago. People who reported eating seafood less than once a week had worse memory problems than people who ate seafood at least once a week. So I just think about Seattle and how lucky we are to have access to fresh seafood. But it can be canned fish, it can be fresh, shrimp, lobster, and crab were also in that study. Although most people would say that the fish is a little healthier than the crab, probably because you put butter on the crab and lobster, at least I do. It's sitting right there. I try to avoid it a lot, but anyway, and then mixed nuts are helpful. And then some people are also looking at curry. You can get curcumin or turmeric as a supplement, or you can eat curry. And the compounds in curry seem to help nerve cells grow in the lab better. Leafy greens, again, that group from Rush, they took an enormous amount of data, looked at what people are eating, and tried to, again, kind of dissect out like what were the healthiest parts of their diet. 9 servings a week of leafy greens, people that ate at least 9 servings a week, so at least 1 a day, sometimes 2 a day, you're scoring better on cognitive testing. And they mean spinach, lettuce salad, kale, collards, and greens. Leafy greens have a lot of compounds in them. One of the compounds are flavonols, which are antioxidants that are found in leafy greens, but they also have other parts to them. And flavonols are also found in beans, apples, blueberries, olive oil, tea, and I don't know exactly which kind of tea. I tried to suss that out, but couldn't get a straight answer. But your herbal teas have flavonols, and then tomato sauce. So kind of some themes, again, the fruits and vegetables, and teas now starting to be on the list. I'm going to spend just a second on alcohol. You know, it's true that in our midlife, and of that, what do we mean by our midlife? Around age 40 to 65, people who drink like 1 glass of wine a day or 1 drink a day do have lower risk of heart disease and stroke, but that starts becoming more problematic as we get older. At age 65 or older, the sensitivity that we have to sedatives, including alcohol, may start outweighing the health benefits of alcohol. So I wouldn't advise people start drinking in their older ages if they don't drink already for their health, because I think they're going to fall, you know, they're going to have other problems. And, you know, if you want that health benefit, you have to drink it in midlife. So the recommendation is for older adults, age 65 and older, the American Geriatric Society recommends limiting to 1 drink a day for both genders, for all genders. And then for persons with dementia, minimize alcohol just because it can increase confusion and falls and can interact with medication. There's other diets out there. There's so many other diets out there. You know, if you're trying to lose weight to fit into a dress or a suit, like for a wedding or something, diets do work and you lose weight for that wedding, but they don't really sustain. So I don't necessarily think about like a healthy eating and weight loss as being necessarily the same thing. For me, diet recommendations are what should we be stocking our fridge and our cupboard with for lifelong diet habits that will keep us healthy for a long time. And so that, you know, so then getting into some of these other diets, you know, if you have diabetes, you may have to cut back on fat more than the Mediterranean diet recommends. The DASH diet we talked a little bit about, that's for high blood pressure or kidney problems. There's a lot of overlap with these diets. What I'd say about supplements, there may be a role for a multivitamin and some vitamin supplements for some people, but when they're studied in the lab, unfortunately, supplements just don't have as much benefit as the food itself. And I think there's 2 reasons for that. One is that foods are really complex and have a lot of compounds in them, like fish, like leafy green vegetables. And if you purify it down to 1 compound and take that, it's just not going to be the same. The other thing that eating the healthy food does is it prevents you from eating non-healthy food. If you're taking a supplement and then eating red meat, it's better to actually eat the fish, right? Because the fish, when you're eating fish, you're probably not eating the meat unless you get both. But eating healthy food prevents us from eating the unhealthy food because you can only eat so much a day, and also gets us all those compounds. What I would say is also, it really depends on the different stage. So if someone has a dementia diagnosis already, you know, first, you know, if it's not Alzheimer's, there's not a lot of data on what we should be eating for like Lewy body or frontotemporal, but I'd say these principles probably apply across the board for brain health. But if you've already been diagnosed with dementia or your loved one has, for early stages of dementia, there is data that sticking to an exercise and diet and health program can prevent the decline. So, you know, it won't cure the disease, but it may extend the number of years that someone lives in an earlier stage. So I think it's important to keep at those things if possible. And with the idea that you got to pick a diet you can live with. You know, if you're a vegan, I'm not asking you to eat fish. We go against that. You know, there's a lot of other things you can eat. For middle stages, I think this is kind of complicated. So some dementias can start causing problems with appetite or swallowing. And so at that point, you're really thinking about getting enough protein and calories is kind of your goal, so you're not frail. And so there, it's like, if they want to eat the ice cream, okay, they're going to eat the ice cream. The getting enough protein and calories is maybe a more important goal than eating the 10 approved foods by Rush University. And then staying hydrated is also really important. People in this stage sometimes don't feel thirsty. So I think, you know, picking the meal battles in middle stages is a little different than, you know, the battle for prevention and also for early stage, like me and my husband at Costco, and me taking things out might have been put in the big bag of M&Ms goes back on the shelf. For middle stages, I think again you're a little more worried about frailty and dehydration. And then if someone's in their later stages or they're really not aware, you know, they're needing a lot of help at home, I suggest a comfort-oriented approach, and you know, they may also have swallowing difficulties. So at that point, you're going to be working with nutrition or nursing to see what kind of food they can swallow and eat comfortably. And I wouldn't worry about the health per se, unless they have diabetes and you don't want their blood sugar to spike. Ice cream, all of this ice cream is fine. So hopefully I left some time for questions. Thank you so much for listening.